You're listening to Age to Perfection, where we redefine aging, celebrate every milestone, and empower women to thrive at every age. We're so grateful to have you as part of our community. Don't forget to hit that subscribe button so you never miss another episode. Cheers to being aged to perfection. Hi, guys. We are here today with Brent Eaton. Those of you who don't know Brent, he is an NP who has been practicing for 15 plus years. But more than anything, I wanted to invite Brent to do this podcast because Brent practices aesthetics and he is a male. And I really want to pick your brain about male aesthetics. So welcome. And today we are drinking an Albarino. So we had talked about what we wanted to kind of drink during and hang out during this podcast. And I'm like, well, if I have to do wine. So I picked something that's kind of a middle ground. And I think most men want a middle ground. They don't want anything too crisp. They don't want anything too soft. We just have to kind of make it all balance and work together, right? Mm-hmm. So cheers, Brent.
Cheers. And
thank you for spending some time with us today.
Thank you for having me on. I appreciate it.
Okay. So I kind of want to break this up into, I want to ask you about men's anti-aging, inside, outside, skin, body, all of it, but from a patient perspective as well as a provider's perspective, because I think guys have a very hard time having this discussion and they feel like if they ask some of these questions, it takes away from their masculinization. So, let's start with anti-aging. Okay. What do most men think of when I say anti-aging? Like, what do your friends, if you're at a bar and someone says anti-aging, what are your friends going to say?
Typically, because that's such a key word nowadays in today's time, they don't immediately think of their face and aesthetics and things like that. It's more
you're evolving. I love it.
Yes, it's more of when you're talking about anti-aging, they think more towards like working out, like stem cells, things that are regenerative and feeling better.
Got it.
Versus the aesthetic side of it. But as soon as you start to talk to them a little bit about that, they can see how it all kind of works together.
Okay, so how let's talk about the men's aging process because it's very different from women, right? Mm-hmm. And I feel like women, we start earlier. I think and maybe it has to do with all the pregnancies that we go through kind of earlier, late 20s, early 30s, that does change our appearance. It changes our body composition. Mm-hmm. Whereas men, I feel like, when did you feel like, oh my God, I'm aging?
So it's really different with men because we're taught not to look at that. It's not manly, so to speak. And then also, as you start to age, there's also the thing of with like some of these older actors that are so handsome, like you think of like Brad Pitt, George Clooney, and you can tell basically from seeing them, on screen that they don't really utilize any type of Botox or neurotoxins or anything like that because they let everything kind of show. Skincare may be a different story, but one of the things is that you're taught that you like men age like a fine wine, so the wrinkles, cray's feet, and things like that are really expected, and they make a man look more distinguished and handsome. So that then there's that fine line of as that starts to progress, it almost becomes too late at some point because the static lines of things that the loose skin, the skin damage, all that stuff really will get irreversible at some point, or at least you could maybe pause it, but not really reverse it to back to where you were when you're 30s or 40s. Yeah. So
when does the inside start aging for guys?
The inside, well, so it's actually nowadays it's a lot earlier than it used to be. So a lot of that has to do with.
I think, and I guess maybe even when I was doing family medicine, I feel like I saw more of the dad bods and like the decline, like late 40s, early 50s.
Okay. I was actually referring more to like an energy level.
Okay, fair.
Like that.
Is that the first thing you guys notice?
I would think that's the first thing that I noticed.
When did you notice your energy declining?
So my energy started declining when I was in my late 30s.
Okay.
And come to find out that it ended up
Did you chalk it up to just life?
I thought it was having, 4 kids and working a job, just, running ragged and thought that might be it. Always worked out and everything. So I was like, well, what else could it be? And then, of course, go and get lab work drawn like you're supposed to. And
yes. And then all the lab work shows
everything's normal. Yeah. And then you keep pushing and pushing and pushing and you find out, you end up wanting to get your testosterone checked. and my testosterone was actually really low.
Okay.
And so it was actually borderline right at the low end of normal, 300 on the scale.
So now when do you advise your patients to check it?
I think a lot of it has to do with the way that they're feeling. So it's symptomatic.
Okay.
So actually,
you don't just tell them, hey, listen, at 35, I'd start checking.
No, I mean, it's probably going to eventually.
And we're not going by medical guidelines.
Yeah.
We're going by practice, obviously.
I think it'll probably at some point get to that just because it's becoming more and more common to see younger men with lower testosterone levels. But no, it's very symptomatic. And that if, I urge someone, if they've looked at every aspect of their life, their nutrition, their exercise, and they're still just dragging a lot of brain fog, starting to get a dad bod where you're starting to get more weight around your midsection that you just can't get rid of. A lot of those things are signs of low testosterone. And that's at that point is when you want to kind of go down that rabbit hole and see what's going on there.
Okay, so let's talk about the T word.
Mm-hmm.
What are the benefits of replacing testosterone?
So right off the bat, you get a little bit higher energy. You get a higher libido and sex drive. The equipment works a little bit better when your testosterone's in a normal range. You start to hold on to a little bit more muscle.
Okay.
And decrease in body fat.
Do you have to go to the gym for that, or does that just with taking testosterone you can use
to a point that will help some? But if you really want it to get the most advantage out of it, you want to lift weights and exercise because of that actually will naturally raise your testosterone level as well. So the answer is not to go dive in and get the highest dose to get your testosterone level as high as you can because you think you're going to put on muscle. That's not true. You have to work out and do things and be active to be able to get that to work for you.
When you talk about taking testosterone as a supplement, do you start out at a lower dose versus going at a higher dose? How do you recommend your patients?
Yeah, absolutely. One of the first things that you'd want to try is you want to tip your toe in the water before you just jump in. So a lot of them are, the topical creams is one of the easiest, least invasive ways that you can get them to do it. There are some downsides to that because you have to do it daily. You can transfer it to like kids and pets and wives and stuff like that. And of course, that might raise their testosterone levels a little bit. So that's the downside to that.
Yeah, none of us want hair, thank you,
no.
on our bodies. So please.
So there's that. And then the next step would be doing injectable. And you can do it several different ways. There's intramuscular, which are deep injections once a week. There's subcutaneous injections, which go into your fat. Little less invasive, doesn't quite hurt as much. Actually will give you a little bit steadier level in your blood as it gets absorbed over time in between injections versus these big spikes and crashes. And then there's also pellets that you can get inserted. And the pellets will actually last you for typically around like 4 months or so, 3 to 4 months. And you only have to go in that once every 4 months. You get your level tested. They calculate your dosage that you need, put those pellets in. It's more invasive. Of course, it's a little poke hole and they implant them in. But the fact that you don't have to stick yourself with a needle once or twice a week is some people like that.
And guys are, I love y'all, but y'all are lazy. You guys, you don't do half of the. Okay, so speaking of that, if I'm having these amazing benefits, I have lots of energy. My libido's great and it's back, and I am feeling like everything works like a 20-year-old equipment does. I'm sorry, when the rest of us saw people taking Botox and looking good, all of us jumped on the bandwagon.
Absolutely.
So why didn't you guys start a bandwagon? Because testosterone's been around for ages. Testosterone replacement has been done for many, many, many years. Yeah,
because I think it was taboo a long time ago with anabolic steroids and designer steroids, which is a completely different category of what we're talking about. And so no one really wanted to admit that they were on it because they thought that they were cheating or doing something illegal or something like that. And what we're discussing is bioidentical hormones, which are mirrored basically on what we produce in our own body. And I mean, actually, there's really no way to get big and buff off of these. You'll get
even if you try,
even if you max your dose out, you'll get complications and high estrogen and stuff before you'll actually get big muscles. So that's a lot of it had to do with that, and they just didn't want to admit that they had something going on.
So are you guys talking more about it in the locker rooms?
Oh, absolutely. Like the last probably 4 to 5 years.
Has the locker room conversation changed?
Yeah.
So
What are the guys asking? Like, how is it being brought up? What are they
Well,
saying?
so it's funny because no one would ever bring it up to your face if you're in shape and you're working out hard and doing stuff like that. And I actually, in the last year, I've had multiple people who come up to me and they don't even ask what I'm doing like that. They're like, how do you keep your testosterone level up? And I'm just like, oh, good.
That's specific.
That's
question.
specific. And I'm like, well, let me tell you, this is what I do. And I'm not shy about it. I think, I think everyone.
Be. And I think that's why we are sitting here today, is because we want everyone to know that all of these wonderful things are out there. They are no longer taboo. And there's ways to do it where it's natural and it's, overall without having the bad side effects that we've kind of all heard about. So let's talk about the side effects of testosterone.
Mm-hmm. Of course, when you get high testosterone levels, like the biggest one I could see would be that you get a little bit more hair loss. Mm-hmm. No, but no, that was
like, this is genetic.
That was happening anyways. My dad's bald, his dad's bald. Yeah. So it's one of those things, but yeah, so you could start to lose a little bit more hair. There's some other supplements and things that you can do and other mechanisms to hang on to
and
the
I think
hair.
People don't realize that. And I think a lot of guys don't realize that, yes, there are side effects, but now we can treat those side effects,
Absolutely.
right? Yes, you're going to get hair loss, but guess what? None of our testosterone patients are not taking minoxidil. Everybody is being put on minoxidil because we want to make sure. If you're done having kids, I am putting you on finasteride.
Yes, absolutely.
As long as the equipment's working, we are going to do finasteride or dutasteride.
Yep.
Because we have to, with hair, you have to preserve what you have. Otherwise, it's done.
Absolutely.
Like once it's gone, right? Mm-hmm. What about something you talked about? If you get too high of a levels, then you get estrogen.
Yes. Yeah. So with your testosterone levels, you have receptors in your body. And so when your levels get so high, they can only accommodate so much testosterone that you're getting in your body. Then they become saturated. And then you get what's called a down regulation, where it converts it to estrogen. And now all of a sudden your estrogen levels increase, which makes you hold on to fat more. Actually, yes, you get gynecomastia, which you get some man boobs, which nobody wants. It actually can cause erectile dysfunction as well when you're taking too much testosterone. Mm-hmm. So it's kind of a fine line. The other one is you can get a little bit of acne, but bioidenticals, it's really not an issue at all. That's if your testosterone levels maybe got a little too high. That may be something that would happen, but that's more with like designer steroids and stuff like that. That's an issue that people hear about.
What age should people be asking these questions to their providers?
About whether they need it or not.
I know we talked about going symptom based.
Yeah.
But let's say you're perfectly healthy and you're just one of those oblivious people, or you're someone that's interested in saying, you know what, I don't want to wait until I have symptoms.
Yeah. I would probably say 40 would be a good age. Like, I mean, that's what I would personally say is if it's me as a provider, if I was actually in family practice, I would probably screen all my 40-year-olds like, hey, are you having fatigue?
Go ahead and run the testosterone levels.
And then just run
annual checkups.
Yeah, absolutely. And just see where it's at. And then even if you draw someone who's low or low normal, you don't necessarily have to replace it. You can have that conversation with them, bring it, say, hey, I noticed that you put that you were tired all the time. I noticed that you said that you're really not in the mood with your wife anymore. Like, is this something that is going on or you have no control over? And then you can have that conversation and move forward with that.
Yeah. I've realized guys don't open up about these things as easily as women do. Mm. Like women, we have an issue. We speak TMI. We all speak TMI. And most of our great friendships have happened through TMI. You go to a party, you meet someone, you learn their life story, and all of a sudden you're BFFs. Mm-hmm. Guys don't talk. You guys don't ask these questions, right?
No.
So
because you're almost embarrassed to ask.
You're most embarrassed to ask. So is this something that you should be going ahead and asking? Or do you feel like this is where I play the patient card, right? If you were a patient, you're coming into my office, how are you going to bring it up? What is the more comfortable way for you to bring it up?
Honestly, I think a lot of people are like, guys are just in that aspect where they're not going to bring something up unless somebody notices it and brings it up for them and says something about it. So I will say though that, you know, with everything with social media and all that now, that's actually doing some good is it's making people more aware. And so that now people are more coming in asking like, hey, is this something I should be concerned about? And it's bringing the symptoms to light on what they should be looking for. Because your average person running around that doesn't have any information on it, they're just going to chalk it down to just working hard and being tired. And that's life. Like,
yes,
that's what they're doing it for. So it's really good that it's getting out there. The knowledge is getting out there and empowering some men, women, whoever to ask those questions. And
well, for me, most of it's like, oh, my husband is doing this. I need to bring him in. I'm like, yeah, yes, you do. Mm-hmm. So I bypass that because their wives are bringing them in, right?
Right.
I don't have to worry about the wives are like, he's not looking so good. I need him to look a little bit better.
Right.
What are some of the questions that you as a patient should ask when you are having this conversation?
Just say, you know, could you please, you know, with your provider, say, hey, can you please, you know, tell me why don't have any energy?
Okay.
Or why am I doing all the things right? Why do I have this great diet for the last 6 months? Why am I working out and this just won't go away? You know, there's all kinds of great questions that you can ask, and it'll set off that cascade of questions that they can ask to be able to figure out what test they should run to see where you're at. But it's just the biggest thing is to be open. Like men hide their symptoms. Like you really, really should just, you know, medical providers aren't going to tell anyone. They're legally bound to hold that tight. They can get in a lot of trouble. So you just be open. There's nothing to be embarrassed about. And, whether or not you're talking to a male doctor, a female doctor, nurse practitioner, PA, you should always really kind of lay it out there when you're there, because if you don't, you may miss something that, number one, you're wasting time in your life that you could be feeling better, or number two, it could be something more important to find out about that you need fixed.
And I think what most people don't realize is we think about testosterone and we're like, okay, we do testosterone to have muscle. Like you said, people automatically think anabolic steroids and synthetic steroids. Or you think, the equipment doesn't work and I need help and that's why I'm taking testosterone. I think men don't realize the long-term benefits of testosterone. Mm-hmm. I think they don't realize that you're not taking testosterone for the dad bod. You're not taking the testosterone for the libido. You are actually taking the testosterone so that when you're 80, you're still able to climb the stairs. You're still able to do the things that you want to do. You're still able to run around with your grandkids, right? Mm-hmm. And believe it or not, with everything I learned with testosterone, my own grandfather, this man, when he passed away, he was 93 years old and he took a fall 6 months before that. He was bedbound. I kid you not. I so badly wanted to give him high dose testosterone because we know that it helps so many things, even with muscle and even at the end of life. We all get that bad rep. Oh, you're going to have a heart attack, so you can't do testosterone. Oh, it's going to cause cancer, so you can't do testosterone. I think people don't realize that that's not true.
Yeah, they've actually proven that wrong recently.
Yes, they have.
Yeah.
How old is too old?
I think
would you have let me give it to my 92-year-old?
Oh yeah, absolutely. I would definitely have him have a thorough physical and, you know, make sure
he's 92.
Yeah.
Come on.
I definitely would do it. And I mean, work them up to the high dose. Yeah. I would start low and move it up. But yeah, 100%. I think that would be okay.
It's never too late. I feel like it's never too late to feel good. Even if you're at the end of your life, feel good for the last however many days you have left.
Absolutely.
Right? Okay. So we kind of went through the inside. Let's take a look at the outside. Okay. When we talk about men's aesthetics, how does the outside translate to life after 30? Like, at what point did you decide, maybe I should, slap on some sunscreen or do a little skincare? Yeah.
So I was one of the, typically one of the ones who was more kind of stubborn about it. And I didn't want to give into it either. And what made the biggest difference for me was, so I got into aesthetics 8 years ago. I'm 47. So I was 39.
Thank you for sharing your age.
And
you look amazing.
Thank you. I actually held off for about 2 years when I was doing it. And because I was working at a spa in Houston, Persona, and they finally grabbed me as a guinea pig for a training. And they were like, you're it. Everyone else has had theirs done. Get down there. I just finally gave in and said, fine. And I really had I had 4 deep set lines going across my forehead that were pretty severe.
Why were you holding out?
same thing, just trying to be stubborn and be like, I don't need that. You know, I'm a man. I'm going to look good as I age.
Which I will give you. You guys definitely, God blessed you with that. Not only do you not have to birth babies, but you age way better than we do, right?
Yeah, it's kind of unfair for y'all, but yeah. So yeah, I had that done. And then, you know, as soon as it kicked in, of course, the lines didn't go away for about 6 months, but I did go ahead and follow up and get in their treatment. But between 6 months and a year, those lines disappear when everything remodels, when you don't repeatedly have that creasing going on. And I put some pictures side by side, and it was like a 10-year difference in my age is what it looked like. It reversed it. It was, and so I was like, I just can never go back. And it doesn't mean you have to be frozen. It doesn't mean you have to look fake.
Yes.
Yeah.
And I think, and this is where I think Instagram and social media kind of scare people away a little bit, is because not just Instagram and social media. Let me take it back. Your wives are scaring y'all away half the time. Okay. Like I know. Yep. The biggest thing I get is please, this is the face I married. Please don't change the face I married. Mm-hmm. Please don't change who my wife is or my girlfriend or whatever. Yep. So men are really, really afraid of that changed look. But what's your advice? Because I know you being a male practitioner, I know you get a lot more male. So what is your advice to them on not being afraid of this?
You know, I think it takes a lot for your typical male to even be able to call up and make an appointment and walk into the office. I think they're going to be looking around like, who's going to judge me, like that I'm here and stuff like that. So a lot of times it's more of a wife bringing a girlfriend, bringing them in, a sister or something like that.
How do we change that?
I just think a little more advertising, make it look a little more friendly. Like having me on, I think is a great first step and things like that. Having male injectors,
yes,
I think is a big step
agree.
as well.
That's the biggest reason I wanted you to come, because you are 47, as you said. You look amazing. You have 4 kids and 5 kids. Sorry, 5 kids. Sorry, Zelene. 5 kids. But you look amazing.
Oh, thank you.
And I think what people don't realize is you can look amazing without looking crazy.
Absolutely.
Because you don't look crazy. You look like a very well put together man, right? And so people don't realize that there's that balance that you can accomplish, right? So let's talk about Bro-tox, right? You already said that you do it. Mm-hmm. How often do you do it?
So now, not to throw him a pitch, but now that Daxify is out there, I actually only have to do it like once every 5 months or so. It's really not as often. So it's a Daxify that those of you who don't know is a neurotoxin, longer acting.
Yes, it's your second generation. So it's
amazing at how long it lasts. I've tried up all the other ones, and because of the amount that I work out and stress and all that good stuff, they burn off.
Kids will do that to you
in about 2 months. And Daxify it's been unreal on how long it makes it last. It's also a little bit softer look, I feel like. So it doesn't look like you've had anything done. Yeah. And then you got to choose a good injector. You don't want someone who's just going to freeze you and send you out there. You want to be conservative.
And an injector who knows the difference between injecting men and women.
Absolutely.
Y'all, there's a lot of injectors out there, and half of them learn how to inject on TikTok. So realize that there are different ways to inject men and women. Absolutely. There's different frequencies too. I will tell you, for most of my men, I only inject them twice a year. Whether they're doing Botox, whether they're doing Dysport, Zeman, Daxify, I only do because, like you said, Brad Pitt has lines. Mm-hmm. George Clooney has lines. Richard Gere, my God, he's gorgeous. He has lines. And they need that line. Mm-hmm. You need a few soft. You cannot have the Grand Canyon on your face.
Right.
But you need some soft lines. So
absolutely.
Is that about how often you recommend your guys are doing it? About twice?
Absolutely.
Twice a year?
Yeah. And that's what I see that they actually come in. Yeah.
If they're high metabolizers?
I don't have any that come in that much, but that's, I mean, I would be okay with doing that to help keep those lines away and things like that.
What else are you substituting it? So I think guys don't realize that there's a lot more out there than just spending time slapping a bunch of creams onto your face and then getting people to inject a bunch of crap into your face.
100%. So when I have a guy come in, and I do this with my females too, is I just say, what are you here for? Tell me, what's your concern? That's the biggest thing I say. What are you concerned with? And they'll point out what it is. And at that point is when you can kind of chime in on the things that your go-to. And I kind of lay out there what I think is the plan of action, what you should start with. It all depends on, how much they want to spend too as well. You got to kind of judge that as well. With guys though, I think it would almost need to handle it with a little bit more kid gloves, is be like, you can't throw everything at them at once because they're going to get overwhelmed and never come back.
Okay.
So you almost
Fair.
need to take it step by step. And so, one of the easiest things, Botox is very, very simple and easy to do. Treat those areas, get it going. And then I like to always tell them, just very easy. You can't throw all these exotic creams and lotions at men either. So I'm like, you know what? If you're not using a good face wash, get a nice gentle face wash. Sunscreen, wear it.
80% of aging
Yes.
is sunscreen.
Yeah.
Just wear your damn sunscreen.
Some-
That's 80% of the battle.
Throw some sunscreen on and then get a basic moisturizer for at night.
Yeah.
And 9 times out of 10, that's going to set a base that's going to get you healthier skin and conditioned
You
skin.
don't do retinols with them?
I start them with that.
Because
And then
you're
when
worried
they-
about the retinol reaction.
When they come
with them.
back, and if they're like, well, what else can I do? This is nice, but I thought it would make more of a difference.
Yeah.
Which it won't. It's not going to change
No.
complexion, skin damage, things like that. The next step would be a retinol to try to get some of those fine lines, wrinkles, to turn the cells over in the skin and get, that little cheat code with that going. Yeah. But I don't want to hit them with that first, because I think once if they do too much too often, if they're sensitive to it, they start getting itchy, red, burning, maybe peel a little bit. But now they do have some that aren't as strong. So and they do have moisturizers combined with them. So that's a big difference. But yeah, you don't want to do anything too drastic with a guy, because then you'll lose him as a patient. Yeah.
Okay. Good advice. Thank you.
Yeah.
I'm going to keep that in mind. No, really, I'm going to have to go back and listen to this and really kind of tweak it on that portion of it. When it comes to other things, and I know like you do all these other things too, and I've lasered you, you've lasered other people. Where are you throwing these things in? Like, because you said that's too much for guys. So how would I approach a guy to say, listen, okay, I'll give you a prime example. My husband, and he doesn't have a choice, right? He has to do what I tell him to because he's stuck with me.
Right.
And so for him, when I do his anti-aging, I do his toxins twice a year. I do one big aggressive laser once a year. And then, I do beat him up with a little microneedling every so often. And then when he doesn't have time, I'll do a little laser genesis. But again, he has no choice. He has to do what I tell him to do, right? What is too much for a guy? Or what is not enough? Or where's that balance for you guys?
I think it's going to be very individualized with the guy. They're all going to be kind of resistant to it because they don't want to do too much or do anything too drastic. Or the big thing would be they don't want anything that there's going to be some downtime for if they have a job and stuff like that. Because again, they don't want everyone knowing that they're doing this stuff. They want it to kind of be a little bit of a secret. So modalities that involve little downtimes, things like that, are probably the best. That's why, one of the things, well, let me back up. I also, the concern, that's another thing whenever I ask them about what's their concerns and what they have, I'll kind of address that. Because if someone says they've got puffy under eyes, they've got wrinkles under their eyes, they've got this, I don't like the skin damage, that, sun damage, stuff like that. And then you can kind of chime in
But do guys think about that? Do guys look at their face and be like, I hate this sun damage?
They won't call it that. They'll be like, what do I do about all this stuff on my
Spots
face?
on my face.
Spots. Yeah. I've had guys come in and say that. And you just, like I said, you just don't want to do too much, but like start with like retinol and things like that. And then you can work in some things with some lasers and things that aren't as aggressive. To really get that down. But if you go in and try and do like a CO2 on them high level, like you'll never see them again after that.
I mean, they'll be looking amazing and fantastic. Their wife will be
traumatized.
Yeah. They may not like me very much, but
they look good. Yeah, they'll look good after it. Yeah.
Okay, so then what is, how about you as a patient? Tell me as a patient, you already said you do toxins twice a year, usually thanks to the Daxify. What else are you doing?
So as far as skincare, I use a good face wash, a sunscreen. At night, I'm off and on with a moisturizer because I'll use some retinol. And I'm not an avid user of retinol. I do it maybe like once or twice a week just to kind of touch it in. I don't like the irritation. I have sensitive skin, so I kind of listen to my skin and just do it a little bit. And I mean, just throwing it in once a week makes the vial or the bottle last longer, which is something that guys always want to save money. And then it's not as irritating. You still get a good benefit from it. You can really tell. The toxins, of course, one of the things as we get older, guys who like to work out a lot, you lose weight. And where do you lose that weight is in your face. So, and not only that, everyone, men and women, you start to lose some of your bone structure. So you lose the bone structure, the fat pads, you lose the bone structure. So everyone thinks that their skin is sagging when it starts to get a little bit loose.
But it's not.
But what's happening is they're losing the fat that runs through here and the thickness of the skin and then the bone, which is the structure. So you don't need a facelift right away. You don't need to cut out skin and tighten it back up. You really need to replace the structure that's underneath there is the best thing to do. So I do what's called Sculptra. Mm-hmm. So Sculptra is a PLLA, which is, I always like to say, no one knows this because I'm a surgery nerd because I was in surgery for 24 years. But it's the same thing vicral sutures are made of.
It is.
And so it keeps you from scarring as bad. Yeah. And so what it is you inject it right under the skin in the subcutaneous layer. And one of the most common areas is just this area, like I call it the beard line for guys. It's when you lose that, you look sunken in when you lose weight, and you can run it all through here. There's some other places you can put it as well, but it replaces your natural collagen. So it's really nothing that you never had.
And you don't have to worry about that like crazy fake look that everybody thinks.
It's not a filler.
That women, because it's not a filler.
Yeah, absolutely. So it's gonna make you look youthful. It replaces all that youthful fullness in your face that you had, your jawline and everything, and it looks fantastic.
What about procedures?
So procedures I've had. Let's see here. So when Morpheus came out, which is radio frequency microneedling, that was about 6-7 years ago, something like that, maybe a little longer.
7 years ago.
So the spa I was working at had that, so I got to be a guinea pig. And I really enjoyed that because I hadn't had anything done before, and it really tightened up my skin. So what that is a device that has 36 needles on it, and the same thing with the Secret Pro and RF. And so
essentially any RF microneedling,
the same energy, they use radio frequency energy with a certain amount of needles. So it's like 36 needles penetrating the skin to the depth that your provider wants to do. A lot of times they layer it like a cake. They'll go superficial, medium, and deep. And each time the needles go in, it will actually stimulate the radio frequency, which is surging energy into you. And over time, what it does is it causes that tissue to contract and tighten and stimulate collagen. So you're getting your skin layers thicker, which is bringing that fullness back out a little bit, and it's tightening back up. So it's like I guess a good word for it is like a non-surgical facelift is what people describe it as.
And I think what guys need to understand, and one of the messages that I wanted to, I guess, convey with this podcast is there's a whole world out there of procedures that don't require downtime, that you don't see that anything happened. That is, I feel like most guys should take advantage of it, right? Like I said, these minor lasers, laser genesis, a picogenesis, all of those things at the end of the day, you don't see a drastic difference. But if you make the time for it, man, do those little things add up, right?
Absolutely.
And guys want little. They don't want big drastic changes. You guys want little miniature, things.
So I would definitely say, like, versus what you were talking about, you can do microneedling. And there's also laser genesis. So microneedling is fantastic for conditioning your skin, stimulating collagen, but there is downtime. And so you can substitute that with something like laser genesis, where you don't even have to numb. You walk in, usually about 15 minutes later, you're done. It feels like warm raindrops on you. It's actually relaxing. Warm raindrops on your skin. You come out and you may or may not be a tiny bit pink for about 30 minutes. Yeah. And then you're good to go. And it stimulates collagen, helps turn the cells over.
I love it. I would do it every week if the protocols allowed it.
Yeah.
Okay, so let's go. I'm going to do an example. I always do that. If you get a male client, 55, about 50 extra pounds to lose, mostly stays indoors, has a few wrinkles, kind of give me your advice on how to start, where to go. I don't want to look different. I would love to look like my 45-year-old self or my 40-year-old self.
You said 50 pounds overweight?
55 age and 50 pounds overweight.
Okay. So you're talking like encompassing the whole thing. Okay.
Now you're the practitioner.
Okay.
Not the patient.
So few wrinkles on the face. So typically what will happen, the way that I look at this is, number one, I'll ask them what his complaint is. Traditionally with that person, they're going to say, I'm tired. I don't feel like doing anything. I'm overweight. What do I do with this? Now, at first, the wrinkles probably won't be a problem because when you are a little bit overweight, you
look good.
You look great. You have a little bit of fat in your face, so everything's nice and smooth.
Yes.
There's no wrinkles.
Tight.
So I would definitely talk to him about his symptoms, see if he's tired, fatigued, if he's working out at all, get a little idea of that. Definitely run some labs, and I would include a testosterone level in there to see what's going on. Depending on what that came back, if it was extremely low, I'd probably just start with replacing that. Now, if that was still in a halfway decent range, I would actually talk to him about GLP-1 therapy.
Okay.
To help with that. And so to go into a little bit of that. So GLP-1s are your semaglutide, tirzepatide, that are out there on the market. They definitely work by blocking your GLP-1 appetite center, which is where cravings come from. Yeah. It tells you you're hungry. So it blocks that. It's a cheat code is what it is. It's not the answer. So
no.
I want to tell everyone that.
I call it a software update.
Exactly.
I tell my patients, I'm like, this is your software update for your metabolism.
Yes. So it does that. It actually slows digestion a little bit. So you feel fuller longer.
Hungry. Yeah.
And you can't eat as much at each sitting. So you eat half of your plate and you're just like, I can't do it anymore. You're physically full. And what's wonderful about that is when you add exercise into it, it's just exponential at what it does. And so when I say it's a cheat code, what it is, it's a great time when you're on this medication, not just to let it do its work, because it will work for about a month. And then it's just going to plateau and you'll sit there. But if you do the lifestyle changes, get into a caloric deficit, increase your protein, exercise, and this will actually
testosterone on board. I'm sorry, you should have the testosterone on board.
Absolutely. If it's low, you definitely want to get it back into a normal range.
I've realized as we've been doing this testosterone and GLP-1, like it goes hand in hand.
It's amazing.
It's amazing what it can do together. Right?
100%. And it does the work for you. It's like when I call it a cheat code is because it just makes dieting easier. It takes all the hard work out of it and the negative things.
Easy.
Yeah. So low doses of that only go up if you need to. If it's working, don't do it. If you're losing weight, stay there. So that's going to get you dropping weight. Now, unfortunately, what's going to happen is when you start losing that weight, you're going to lose some volume in your face. So then all of a sudden you're going to be like, I don't know what I'm going to do about this. Starting to get wrinkles because when you lose the fat pads here, you lose some of the fat here, you're going to see the crow's feet more deeper. You're going to see all these lines here. So that's where your toxins can come in. If someone's willing to do it, you could always start them on a little bit of prevention by doing it at the very beginning, just to keep it there. Yeah. And that would help prevent that from becoming an issue when you did lose that volume. But some people just like, it's not a problem. Let's not do it. So you wait and then you can start treating them then when they start seeing it and notice it and complain a little bit about it. When they complain about a little bit of volume in here, when they start dropping that weight, you can do Sculptra. If they want to go a little step further, you can do some of the tightening procedures like Opus, which is plasma energy, the microneedling with radio frequency to tighten things up. And then you just never miss a beat. And now you're all of a sudden you have a smaller, trimmer waist, a little bit more muscle, face is looking on point.
Yes. And just overall, everything's pulling together. Yep. Okay.
The next thing your wife is like, let's go on vacation. Let's go.
Okay. Last question. So you can go on vacation with your wife. Why do you care as a patient? Why do you care?
Why do you care about how you look? Well, it makes.
And why should you care?
Number one.
Why do you care and why should you care?
It's how you feel. So that's the number one thing with anti-aging is you want to feel younger. You want to live a longer, happier life. When you're 80 years old, wouldn't it be wonderful to feel good and not have all these things that some of our ancestors had in the generations that came before us where they never really worked out? They're weak, they're falling, they're getting fractures. Like what happens if you're 80 years old and you're still able to go out and run 3 miles or swim half a mile or lift weights still every day? You're feeling great because muscle is definitely the fountain of youth is what I've found.
It is.
So that's a big part of the testosterone, the muscle building, the working out and exercises. And then, who doesn't want to look good? That's one of the things. It makes
There's
you
actually
feel
a lot
good.
of guys that don't care what they look like.
It really makes you feel good when you look in the mirror and you feel like you look younger than you actually do, which is a fantastic. I know it's kind of a self-centered kind of thing to say, but
no, absolutely not. Listen, women have had this secret. We've been clued in for many, many, many years. Y'all are just catching up.
Yeah. And you'll get, let's say, so the guys that aren't married, it will make you more presentable and look nicer for the women that you're trying to attract. The ones who are married, who have kind of settled into their routine and say, oh, she's going to love me no matter what. You know
Not
what?
true.
No, she's still going to love you. But you know what? When you start looking better,
she might love you a little bit more.
She might love you a little bit more. Yes.
No, at the end of the day, we just want you to love yourself a little bit more. Right?
Absolutely.
That's all. Both of our goals is we just want our patients to love themselves a little bit more, to feel better in their bodies, to close those deals, to sign those contracts, to, get those clients that they've been hunting down.
Oh, yeah.
And I think the biggest reason guys come to me and the biggest reason they walk into my door is because guess what? There's 30 other younger guys waiting to take your spot. So if you don't care, and again, Harvard, MIT, Yale, Stanford, they've all done studies. All of their human life departments and their bio research labs have done these studies to show better looking people, unfortunately, do end up getting the advantage.
And it promotes motivation.
And it promotes motivation.
Absolutely. So.
Well, thank you so much, Brent.
Oh, thank you for having me on. I appreciate it.
Sharing all of your secrets. And I hope that most of the guys out there realize that it is not a taboo subject anymore. I think you should care about, and it's not looks, you should care about your general overall health, your mental health, your self-image health, your physical health, your emotional health, all of it.
Absolutely. I agree.
Disclaimer. The information provided in this podcast is for educational purposes only and is not intended as medical advice. Please consult with your qualified healthcare professional to determine the best treatment options for your individual needs. Results may vary and all procedures carry some level of risk. Always make informed decisions in consultation with a licensed professional.